Hello, everybody. Welcome to episode 2 of the Cardiac Crew. That
Woo!
sounded great, and it probably won't do that again for. I don't know if it'll ever do that again for future episodes. Welcome to episode 2 of Cardiac Crew.
Yeah.
Anyways, if I need a quick introduction, my name is Crisis, and I'm here with Stephanie, and today we are going to talk about strokes. And the reason why we both kind of felt this was an interesting topic to start the podcast off with, even though it's certainly a touchy topic, is at my last cardiology appointment, this was a big concern for my cardiologist, is me suffering mild strokes or a major stroke. And in Stephanie's case, she recently suffered would you call it a mini stroke?
Yeah, that's a TIA or mini stroke is what they call it.
Okay. So she's going to give you kind of the first-hand experience of what went down and what that was like for her. So do you want to start off with your crazy story? Or do you want me to kick it off with kind of my cardiologist concerns?
I can go ahead and tell you a little bit about what happened last week.
Cool. So let's start off with a bang, and we'll just go straight into the scary story of Stephanie.
All right. So my boyfriend and I were at dinner, and I had been feeling really dizzy, and I started noticing that I couldn't concentrate on what he was saying during dinner. And I just thought maybe I was stressed out, which I have been very stressed out with a lot of the advocacy work I've been doing lately, and also writing my book and not sleeping very much. So I thought it was an accumulation of all of that. And I started noticing that I could hear that the cook was chopping vegetables, and it sounded like it was right next to my ear. And I could hear every noise in the restaurant was just magnified.
Wow.
And the lights were getting brighter. And my boyfriend's voice was loud. It felt like he was yelling at me. And it was just everything. It was like sensory overload. But I kept it to myself, and I said, because I don't want to be a burden, and which is a whole nother story. And I just wanted to have a good night and have a nice dinner. So I pretended I knew what my boyfriend was saying and was going, oh, okay. And then we left, went to get an ice cream cone. And I was like thinking maybe I'm dehydrated, whatever. So I drank a bunch of water. We were sitting on the couch and eating our ice cream cones. And all of a sudden, I don't really know how it happened. All I know is that his voice and everything just started getting really slow.
Wow.
Yeah, and I was looking at him, and I was staring at my ice cream cone, and I was like, I could think, and I was thinking, I really want to lick my ice cream cone. Why can't I bring my hand to my mouth? And I'm like, I don't know. I'm having this huge conversation in my head, and I'm staring at him thinking, he has no idea what's going on right now. He's just talking. So I was just sitting there, and I was looking at my hand, and I couldn't bring my hand to my mouth. It's as if I forgot, and my brain didn't know how to move my hand to my mouth anymore. And I was just staring at it, but I don't know what's happening.
Now,
and so
I'm sorry to interrupt,
go ahead.
but I'm
No.
curious here because I want to know, did the doctors kind of confirm one mini stroke or was it multiples?
There's no way of recording mini strokes. There's no way of knowing. That's the unfortunate part about TIAs.
With the hypersensitivity, both with the vision, with the hearing, and then also with the muscle control, it just makes me curious, what part of your brain was affected? Because it really seems like your whole brain was affected.
Exactly. Yeah, it's crazy.
But to continue with the being there with the ice cream cone, the not being able to raise it to your face, and then looking over at your boyfriend.
Yeah. So I was staring at him, and I was thinking, I need to go to the emergency room. I have no idea, or he has no idea how I'm feeling right now. But I definitely am having a seizure or a stroke right now because my brain felt like it was shaking a million miles an hour. It felt like someone was shaking my whole head.
Wow.
But he just kept talking about whatever he was talking about. And then I don't know, I guess he asked me if I was okay or whatever. I don't really remember much after that. He took me to the emergency room, and that's, when I had a really bad experience there where they treated me like a drug addict, and didn't help me. So, which is another, subject that we may cover. So, but that was the beginning of it, and I couldn't use my feet or my legs or my arms or my hands for a few hours, and I actually lost the inability to speak completely for 12 hours.
Oh my gosh.
It was terrifying, but we discovered that I could write after a few hours, so I started writing down what I wanted to say.
Now I'm curious because it's crazy to hear the story.
Yeah.
So at the point when you said you kind of blanked out and don't really recall what happened after being on the couch, what was the point in the hospital really that you kind of became reaware?
I remember going into the parking lot.
Okay.
But up to the hospital, I think I might have been, I don't know, I think I was so scared that I just kind of don't remember what was going on. I was just terrified, and I was like, okay, this is it. That's what I kept thinking. Like, when I was on the couch, I was like, this is it. I'm having a stroke, and this is the end of my brain. That's exactly what I was thinking. And I think I probably disassociated or checked out, or maybe it was neurological instead of psychological, where I completely just blanked out. I don't know, but I know that when I got to the emergency room, I kind of was shocked back into reality because of how they were treating me. So
wow.
I definitely remember being there.
Now, before we get to the difficulties at the hospital room itself and kind of the staff on hand, how long were you in the hospital for?
3 days.
Oh, okay. So not so bad then.
No.
I mean, days in the hospital is awful, but 3 days is okay.
Yeah, it felt like a month, but yeah, definitely only 3 days, I'm very happy about that. And I had an emergency TEE, which is they needed to get to see my heart with a camera. So basically you go through the throat, you put a camera down my esophagus. And so that was kind of a minor procedure where they did, full anesthesia and all of that. So.
And now the putting the camera down your esophagus was more to see what then? Because strokes, of course, occur in the brain.
Right. They needed to see if the blood was leaking through my Fontan. And what they discovered through the minor procedure was that my Fontan does have a tear in it, and blood clots are seeping through that tear and going straight to my brain, which is causing many strokes, because this is the second one that I've been to the hospital for in 9 months.
Oh, wow.
Yeah, but this was the worst. And this was the second one I've been to the hospital for. But now that I know what it is, I feel like I've had multiple of these that lasted a lot less than 12 hours, just because now I know what the symptoms are. Yeah. And like I lost, all feeling in the sides of my body. I couldn't use my limbs. And that has happened before where I just, in the past even few months, but I just didn't go to the hospital because I thought it was.
Right. Weakness, fatigue, like a smaller, symptom of CHD and HLHS, but not jumping to the conclusion that, oh, this is a stroke here.
Right. I would have never, ever thought of that, ever. Like, I just thought I was stressed out and dizzy and stuff before, Now,
I'm going to jump to my story a little and just kind of piggyback off of what you just said. So, okay. I went up to see my cardiologist, Dr. Huda, in St. Petersburg just a little while back. And one of the first things he mentioned is I, too, have a small tear in my Fontan.
Okay.
And it's something that was never really worried about before, because what my cardiologist felt before is if his sats were low, we'd consider closing it. But everything seems okay, so we'll leave it as it is, because my sats are usually pretty decent. But more recently, he's more concerned that as you get older, your blood thickens and clots easier.
Yes.
And his concern is now having one of those clots pass through the tear and go to my brain.
Yep. Exactly what's happening.
So what is the new discussion is, do we do that procedure and do we go in and close that tear? and prevent the clots. Or as kind of is something we bounce back and forth, is something you hear about is the liver damage with CHD people.
Yes.
And we've wondered if, because the liver damage is due to the venous pressure backing up on your liver,
Yep.
does having that hole allow that pressure to escape and then not cause that backflow?
Right.
Because when we did my liver MRI, my results came back good. So we're actually
good.
going to go back
I haven't
up.
had that yet.
You haven't?
Not yet. That's one of the tests I'm going to have in the next few months.
Okay, that's great. So it was something that we've definitely discussed doing a little more frequently, is definitely checking on my liver. Huda is a pediatric cardiologist, so he's going to work alongside with the adult cardiologist that's in Petersburg as well, Dr. Harden.
Yeah.
And the four of us, he is your cardiologist, correct?
Yes, he's amazing.
What is his first name? Just curious.
Joel.
Dr. Joel Harden.
Yeah, and he's from Chicago. He just moved to Tampa about 6 months ago, I believe.
Okay,
Very
wow.
new, but I've heard amazing reviews. So
Dr. Huda said that he felt that it would be a great idea if we speak with Dr. Harden. He had a lot of nice things to say as well. So the four of us are going to sit down and determine, close the Fontan, prevent stroke, maybe adverse liver effects, or leave it open and save the liver, but risk stroke. And then in that case, is it, like drastically increase my blood thinner?
yeah. Are you on blood thinner right now?
I'm on baby aspirin. I take a 81 milligram tablet and I take 2 of those a day. So it's a blood thinner. It's not, it's not a major one.
Right.
And when you're a kid, that works. I mean, it's baby aspirin.
Right.
But Huda's concern now is with clots forming so much easier, do we need to either up the meds or just close the hole?
That is identical to what they are trying to decide with me right now. That's so crazy that we're going through this.
Since the stroke, have you increased your meds at all for your blood thinner?
Well, yes. So what happened was they put me on Coumadin right away.
Okay.
In the hospital, and I was on Coumadin as a kid for about 10 years. And it made me really sick. And so I actually talked to Dr. Harden, and I talked to my aunt and my mom about a couple things. And I told them that I actually have not been taking my aspirin for a long time. So,
Oh, wow.
yeah. So there's really no...
That's a no-no.
I know. So there's really, I understand him wanting to put me on Coumadin. However, that was under the assumption that aspirin wasn't working.
Okay.
So what I told him was, at my appointment 2 days ago, I was like, look, I need to tell you the truth, because if I don't, then, I don't want misconstrued data. So I was not taking my aspirin. I have not been taking my baby aspirin for months.
Wow.
So I don't know why. There's really no reason. I guess sometimes I feel like it wasn't important or something, and I would just be like, whatever. It doesn't do anything. I don't know. There's really no excuse or good explanation. It's just me being irresponsible, to be honest. And so he said, okay, so since I wasn't taking it and we were putting you on Coumadin under the assumption that you were, and you had these mini strokes, without being on any blood thinner, then, and the Coumadin was making me sick. So I asked him if I could just go to baby aspirin, and he said, if you want to take the risk, that is your prerogative. You can choose baby aspirin or you can choose the Coumadin. I'm going to leave it up to you. So I chose to do the 2 baby aspirins and see how I feel. And I feel like, again, now that I know the symptoms and I know, the leg pains also that I was ignoring, that went along with before I had the mini stroke, the second one. I feel like there's a lot of things I ignored that I now know. And if I get any of these symptoms again and I start getting worried, then I'm going to, have a Coumadin conversation again.
Okay.
So for now, it's just the baby aspirin. And I'm actually taking it every day. So.
Gotcha. That's good. I too can confess that there had been some periods, as a teen and then in early 20s and stuff, where I would go through these kind of spells of not taking my medication as consistently as I definitely should have. There's of course no excuse. I would say that the thing that came over me was you take it day and day and day, and if it's a medication I've been on for 24 years.
Yeah.
That you're constantly on this regimented words, constantly taking this daily medication, and you reach this point where you're like, why am I taking this? Why always
Yes.
pills and pills and pills and pills?
Mm-hmm.
And then getting caught up in that adult life and that transition,
Yes.
you start having to take account for your own priorities as an adult. And I too made that mistake of like, I missed it one day and I didn't die, so it's fine with. And then before you know it, you're like, when did I take that last?
Yes, that is exactly what happened. It's like, oh, it was a couple weeks. Okay, maybe it was, all right, maybe it's been a couple years or months or I don't know.
I don't know about that. I am going to jump because you said something interesting, and so I'm curious now. You had mentioned ignoring leg pain.
Yes.
And I'm curious what kind of leg pain you have, because I too have experienced leg pain. And sometimes it'll be, slight, where you kind of think like, maybe I was on my feet, or maybe it's just, my ankle's getting sore at the end of the day. And then sometimes the pain's a lot more severe, like in my calves and all the way up, and it just hurts in my extremities all over. And I'm curious, what did you experience in your leg pain? And I'm going to kind of compare that to my own.
Okay. Yeah, it is the calf muscles and just a feeling of heaviness that I have noticed, especially after sitting at my desk and writing for hours. I can feel the blood like pooling at my feet and in my knees. And so I get pain in my legs that feel like if I don't get up and move around soon, I feel like my legs are going to just hurt so bad that, or something serious is going to happen. It's hard to explain the pain. But it is the calf muscles and the feet and ankles. And it's just kind of like, I don't know if it's a shooting pain. It's like a...
If I were to say, I wouldn't say it's a shooting pain. And this is a topic my mom and I kind of discuss a lot, is it feels like a pressure of the veins and the muscles in my leg kind of squeezing.
Yes. Perfect.
It's like a squeezing pain.
Perfect.
And my mom's going to be ecstatic to hear me say this, but something we talk about all the time, and she tells me day in and day out, did you put your feet up? Did you put your feet up?
Yep.
And since I was young, my mom has always said, if your feet start to hurt, or even if your feet don't hurt, make sure you have like an ottoman, or better yet, go lay down in bed and put your feet up above your head to kind of let that blood that's pooling in your feet just drain back down, by gravity. And a reason why we discuss this a lot is jumping back to that idea of the venous pressure, of the veins, because with the strength of the heart really having to pump the blood out to the body and then also pump the blood back up, and for your body to pull it back up, I'm no medical specialist doctor, but the idea that I understand of venous pressure is your veins having to constrict to push the blood in your feet back up to the heart.
Yep, that's what's hard.
That's why you get the pressure feeling, and I'm not going to say I'm great at it, because I'm not a big fan of laying down in bed and kind of feeling like I'm doing nothing.
Yeah.
But it's definitely something more recently I do a lot more, because there's been days where the pain in my feet or my calves is just pretty close to unbearable. Where definitely after walking, like I need to come home and I'll just lay on my floor and put my feet up against the door.
Well, yeah, that's a good question. Is it more when you are in one position, laying or standing, or is it after you have been moving around when you get the pain the most?
If I'm sitting for long periods of time, like you said, writing, like let's say I'm on my computer and I'm studying, or I'm doing, film writing or music writing or something like that, and I'm just sitting there and I don't notice the hours passing by, I'll start to notice like, oh my gosh, my legs like really, really hurt.
Yep.
But then I've also noticed like if I'm out, let's say we're walking and we're at the supermarket and we're kind of standing there getting groceries, by the time we make it to the checkout line, I'm like, Mom, I need to go find a bench and sit down, because my ankles are just squeezing me.
Okay. Yeah.
I found it was interesting that you said that that was something you were experiencing and then kind of just ignored because that's what you want to do. You want to
Yeah.
blow it off and be like, oh, I'm fine. It's just leg pain from the end of the day. Like, whatever. Everyone has leg pain, right?
Yep. Because it's hard to choose, what do I react about and what do I sweep under the rug? And with CHD, especially as in adulthood, especially with complex CHDs, we are realizing that, hey, when you ignore something, even something as little as your leg pain, or a stomach ache or a cough, that could mean something. And as stupid as we feel to go to the doctor for a cough or a stomach ache, or go to the ER for, left side being numb and hoping that it'll just pass. It could really be something. And in the event that it's not, which hopefully more times than not, it is nothing. And a lot of times it is nothing for me. But as I get older, I have stopped caring what these people who I will not see ever again, or just not see very often, what they think. So I just, I can't care what these people think of me. It's my life.
Like peer pressure wise.
Well, yeah, I mean, like the emergency room people, the hospital people, because it's
Okay.
I feel stupid and embarrassed, and they make you feel like you're overreacting about everything.
Yes. I've seen that. I've spoken with doctors and I'm like, oh, I have this concern about this or that. And they'll just be like, that's not a cardiac problem,
Yep.
or that's regular. And I'm like, I don't think so, because it's really painful and I'm not one to complain. Like,
Yep, exactly.
I try not to be a complainer and be like, oh, my leg, oh, my arm. But
Exactly.
if I'm going to stop you and say, hey, this is kind of a concern for me because it's been pretty frequent. And when the doctors are like, nah, I'm sure you're fine.
No, it doesn't mean anything. Yeah, it actually means something. It's just you don't know what it means.
Right.
So why don't you say that instead of saying that it doesn't mean anything?
Something to segue, because this is kind of a current concern that I've expressed to my mom, and we've been talking about with my cardiologist and other cardiologists that I've seen at other local hospitals, is I noticed that I'll have episodes of blurred vision. And it starts in like one eye, the corner of one eye. And when I first started to have it, like so many years back, it was really slight. It'd be like a little bit, and then I would ignore it, and it would go away. And I was like, yeah, whatever. And then suddenly I started to have these severe episodes where my vision would blur pretty much completely. I'd have the photosensitivity to the light. I would just want to lay down in a dark room and I'd get this crazy migraine, this intense nausea, and it would reach the point where I'd end up having to go and throw up.
That's definitely a migraine, I think, like complex migraine.
My cardiologists have thought, yes, maybe it's a complex migraine, maybe it's a neurological thing, but more recently the concern is that maybe kind of like this mini stroke thing? And what I've noticed is that the thing that causes that the most will be any really form of overdoing it.
Mm-hmm.
Like if I become too stressed and I don't calm myself down and say, hey, let's take a breather, let's step away. Or if I don't sleep, if I don't get a solid 8 or 9 hours and I try to just go through the day like, oh, I'll be all right, I can run on 6 or 7.
Yeah.
And then suddenly midday and I just get hit with this wave of like nausea and migraine and my vision goes and I'm done. And after the episode, it's severe weakness for several days. Like I'll wake up the next day and the vision's gone and my stomach's better, but I'm like, just leave me here. I don't want to move. I feel like I'm dying. I'm just going to lay in bed.
Yep.
Don't talk to me.
You feel like you got hit by a bus or like an elephant's on your body.
Yes.
Yep, I understand.
It's one of those things where you want to say, oh, it's a migraine, it's something, it's a complex migraine. But my cardiologist started to look at it and say, well, hopefully it's a complex migraine.
Yeah.
Because it could be something way worse. Maybe it has to do with the blood flow, the veins, the high blood pressure, or the tear in the Fontan. I have a fenestrated Fontan for anyone that's interested in the specifics.
Me too.
The tear is in the fenestration itself.
Yep.
So Do you want to discuss at all, and that this is up to you because it probably gets maybe a little more personal or stressful at this part, but do you want to talk about what you experienced at the ER?
I can cover a brief overview of it.
Okay.
I wouldn't mind.
As long as you're cool with that, because...
Yeah, definitely. It's a very important subject that we all need to talk about because it's crazy how many people go through these experiences. And because we all think that we are one person and one experience, we are embarrassed to share those experiences because we think we're just one story and one person. However, I have learned, especially over the past week, that there are thousands of stories of people with CHD and other invisible and chronic illnesses, and even healthy people who go to the emergency room and are not believed and are treated like drug addicts. It's really scary. And basically, in a nutshell, what happened was my boyfriend and I were together, and he came back with me in triage. And there was this one woman in particular who was very rude, did a stroke test and then laughed and said, this isn't a stroke. This is an overdose.
Wow.
My boyfriend had to leave and go move the car. So when she wheeled me into the back, the guy said, "Hey, what do we got?" And she said, "Overdose," and then walks away. So they treated me as an overdose, and they ripped me out of the wheelchair, threw me on the bed. I had about, I don't even know, 3 or 4 people holding me down, and this guy ripped my underwear and pants off.
Oh, wow.
Yeah, and I started kicking and screaming, and because I couldn't talk, and that's when I discovered I could scream, so I was excited about that.
Oh.
It was like a weird scream. It wasn't like how I normally scream. It was weird sounding.
I don't know how you normally scream, but that's okay.
but yeah, so they said that they need to do a cath to get urine out to test what drugs I've done so that they know how to treat me.
My God.
Yeah, and my boyfriend wasn't there for like a whole 5 minutes, and it was the most traumatizing 5 minutes of my life. And they were all yelling, "What did you take? What did you take?" And that one lady came back and she goes, "Yeah, she keeps pretending she can't talk."
Oh.
Yeah. She's like, "This ain't no overdose." Or, not overdose. This ain't no stroke. This is an overdose.
Hold on. I'm going to interrupt to say, did she say it as, "This ain't no overdose"? Did she?
Pretty much. So, yeah, educated.
It adds to the character.
It does.
Okay. So I'm going to assume at some point your boyfriend comes into the room.
He comes back and says, "What the heck are you guys doing to her?" And I was shaking and screaming and crying and holding on to him. I almost ripped his shirt off. And he says, he could see the terror in my eyes and said, "She has PTSD," which was the wrong thing to say. So then they just told me that it was a mental disorder and that I don't have Yeah, so I, schooled him on that later when I could talk again. But he didn't know, but he was telling them, he told them in detail what happened in triage. We were sitting on the couch and, she has a history of TIAs. She has HLHS. She has severe heart condition. You can call her doctor right now, blah, 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 blah. And that woman still chose to ignore him, ignore the scar on my chest, ignore all of my symptoms, and choose that because I'm young, she is going to decide for herself that it was an overdose and not believe my boyfriend and not believe me. And so she could have caused permanent damage, and I have filed a complaint. And I did create a petition, actually, that
I signed. I want it to be known.
Woo! Thank you very much. Thank you. Please sign if you haven't signed yet.
Is there a link to it?
Yes, there is a link on both of my Facebook pages, the public figure one and my private Facebook page. I made it public.
Okay.
It is also on my Instagram.
Okay.
As the link.
I will see if we can put a link maybe on the Reddit, but definitely down below on YouTube. So if you're interested in signing it, You should be able to find it down below on YouTube.
Okay, perfect.
If not, then definitely go to the Facebook.
Yeah, and share your story also. Anything that you've been through that in an emergency room or hospital or even doctor's office where they didn't believe you because of any assumption, and ignored what you said were your symptoms. And they either say that they think it is, being dramatic, or they think it's a mental illness, or they, just completely disregard you in any way. That is medical negligence. And I am discovering that there are thousands of stories like that. And I'm discovering that we all think we are the only one. And so we don't speak out about it.
I know in my experience, which mine's not nearly as severe as yours, I can guarantee that.
No, I mean, everything is.
But this was my experience with the local hospital here, which was kind of scary because my mom and I determined, like, okay, no more local hospitals. We're going, like, right to Miami Children's, which is still pretty far from us. But I went to one of the local hospitals here when a couple years back, I had appendicitis.
Oh, wow.
I said, Mom, I'd really like to go to the hospital because I feel this lump on my side and I had been in pain for a couple days. And again, just trying to muscle through it. Like, oh, it's just a really bad upset stomach, or I'll be okay. I just must have ate really bad food. But it reached a day and I just felt this bump on my side. And I was like, okay, we need to go to the hospital. And when we get there, some of the stuff that happened was they do the scan and they're like, oh yeah, you got appendicitis. We need to operate right now. And my mom goes, no, we need to go see his specialist because I need an anesthesiologist and stuff like that. So he needs to go to Miami Children's. And they said, oh, no, we can't transfer you anywhere. This has to happen right away. And my mom explained he has this diagnosis, HLHS, da-da-da-da-da. And the woman looked at us like we were crazy. She's like, you what?
Yep.
You have what? I never heard of that. Huh? And so literally the lady goes away, comes back later, and says, okay, I Googled it. We can't help you.
Wow.
You're going to Miami Children's. Hadn't even heard of it. Had to leave and use Dr. Google to tell them, yeah, we can't manage this.
I don't understand.
Another note happened at that same time. Of course, they give you an IV and give you fluids and stuff. And there was air in my line. And, there's like bubbles in the line.
Yeah.
And my mom said, hey, can we do something about that? Because, we're a little concerned about having too much air in his line. And the guy there, I don't know if he was new or in training, but he was like, no, it's fine. You can put some bubbles in somebody's line and they'll be fine. It's not going to hurt them. Da, 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 da. And he was like, I could just put a whole bunch of bubble in his arm and nothing would happen.
Whoa.
And my mom was like, I don't need you to show me. And when we ended up making it to Miami Children's, they gave me what's called a cardiac filter to actually make any air in the line a lot smaller. It shrinks the size of the air bubbles before they pass in.
Okay.
And to be there and to think, oh my gosh, at a standard hospital, like they don't understand, like cardiac patients need cardiac filters and they're just ready to push a bunch of air bubbles in your arm is scary in the like,
wow.
That just sounds crazy to me sort of way.
Yeah. Oh my gosh. I don't understand why, like what the confusion is as far as the lack of understanding. And I mean, they treat us like we are aliens.
As my mom says, they look at you like you have 3 heads.
Yeah, exactly. Exactly. Which will be another episode, which is,
Do you have 3 heads?
Being treated differently and having 3 heads and talking about our 3 heads. But yeah, we definitely need to talk about what it's like being different and, in social settings and in the hospital.
Yes, we can discuss that more. That can certainly be a future episode. The kind of anxiety and the environment of being in a hospital. I've had tons of experiences where I'm sitting there in a hospital bed and all of a sudden they bring in like tons of student doctors.
Oh my gosh, yes.
I become their lesson. They're like, this patient here has HLHS. He's all the way up to such and such age. I had a student come to me afterwards and say, do you really have HLHS?
Yep.
And I said, yeah. And he goes, wow. He said, I read about that in my textbook. I said, oh.
Yes. Oh my gosh. I've had so many people say that to me. We read about you in medical school. I've never met anybody that's actually alive with it. I'm like, oh, okay.
You sit there and you're like, haha, I'm not going to make it.
I know, right? You're like, okay, I guess I'm going to die then. Like,
Yeah,
thanks.
just get me out of here.
And I think they think that it's a compliment when really it's like, this makes me nervous. I don't know.
Yeah. I'll wrap up my appendicitis story here. I had
Okay.
a doctor come in and look at my chart and go, "You had appendicitis?" And I actually didn't have my appendix removed, which is a crazy story for the future. I still have my appendix because in this miracle, it encapsulated itself, and so the bacteria and all that didn't spread. So they decided, okay, let's just mega dose you on antibiotics.
Okay.
So while I'm there getting antibiotics in the hospital, this doctor comes in, looks at my chart, and says, "Oh, you had appendicitis? They didn't remove your appendix? You have this severe cardiac condition?" And he goes, "How are you not dead?" I was like, oh, thanks.
Thanks.
I have all the answers to that question.
Yeah. That's
sure.
funny.
It's funny when you're not in the hospital.
Exactly. Oh, well, thank you for your story.
Thank you for yours.
Yeah, definitely. Feel free to share on Reddit your stories under the petition, share your stories.
Certainly.
And definitely sign.
Anything we can do to help educate people that, as you would say, because I've heard this from you and I really like this phrase, is that there are invisible illnesses that sometimes people are just unaware of.
Yeah.
And it's crucial to educate people in that way so that simple mistakes can be avoided that could totally save someone's life or just cause serious injury or even death, which is,
right.
It's scary that just the difference between someone knowing a condition exists and how to treat it or care for it if they encounter it, between not knowing it exists at all, is a crazy defining factor as to whether people could survive or not.
Right, exactly. And since I started this petition, I actually have one story so far that I've been able to read that did result in death because they were treated as a drug addict. Someone lost their son.
Wow.
Because they ignored, they were so focused on him being a drug addict that they ignored his other symptoms and were trying to treat him as a drug addict, and he had a heart attack and died. So this is very real, and I have written to my senator. I have written to a couple different news stations, and, just so that they can be aware of this issue, because really, this drug epidemic, people need to know the other side of the drug epidemic and how these drug addicts are affecting society, because they are affecting society in a real way by, and that's a whole nother discussion or debate,
That's a rant all in of itself.
Right. Like, whose fault is it, the drug addicts or the emergency room? I mean, I don't know, but all in all, no matter who comes into an emergency room, they shouldn't be legally allowed to assume someone has a condition that their last patient had. I mean, I think that's what it comes down to.
That's a great way to put it.
So why that's not happening is scary.
Agreed.
So
I do think we can probably wrap it up here.
Sure.
To all of our listeners, if you'd like to talk about mini stroke experiences, concerns with nausea, complex migraines, pain in the feet, do you put your feet up? What do you do? What do you experience? Is it a pressure feeling to you? Is it a shooting pain in the leg?
Yeah.
Anything else we talk about, whether it's, are you on a new blood thinner? Do you take baby aspirin, or are you on something stronger?
Yeah.
If you want to talk about, hey, I've had those times when I neglected caring for myself, or I ignored what could have been very serious signs. Have you had those scary experiences in the ER? Whatever stood out to you, the link to the Reddit is down below. Go ahead, post a discussion, post a comment, let us know what's up, let us know if there's anything you'd like us to elaborate on, or just stuff you'd like to hear us talk about. So again, thank you to everyone for listening. This has been another episode of Cardiac Crew. Please help us with the advocacy of spreading both the word of the podcast and better medical care and a stronger community of people with CHD or just invisible illnesses in general.
Thank you so much, guys.
So have a great day. My name is Crisis.
And I'm Stephanie.
And thanks for listening to Cardiac Crew. Bye, everyone.
Bye, guys. Woo! They treat us like we are aliens.
They look at you like you have 3 heads.
Yeah, exactly.